My name is Anthony Charles. I'm the Chief of Division of Trauma, Critical Care and Acute Care Surgery. I'm a professor of surgery. I became a doctor because there are a lot of doctors in my family. My father was a physician. My grandfather was the head of the public health service. He was actually the first African head of the public health service in the whole of sub-Saharan Africa. My uncles are physicians. My older sister is a physician. My younger brother is a physician, so I never thought about doing anything else other than being a physician. The reason I became a surgeon is, one, I actually had a lot of interest in medical school. I thought I was going to be an internist. One of my surgical professors made a comment that stuck with me, and he said, a surgeon is an internist that has completed their education. And this struck with me, and the fact that as a surgeon, you still had the full breadth of medical knowledge, and you could actively do something about patients, and also the results are pretty clear. That fascinated me, and that's why I became a surgeon. A general surgeon, first of all, your training covers a lot of sort of health, sort of body systems, and so you have knowledge about trauma, you have knowledge about thoracic, you have knowledge about vascular, you have knowledge about gastrointestinal systems, and so that gives you a broad breadth. The reality is, as a general surgeon, I could do breast, I could do thyroid. In reality, however, in an academic medical center that has multiple specialties, the bulk of what a general surgeon does is emergency general surgery, acute appendicitis, diverticulitis, incarcerated hernias. And elective general surgery is a lot of gallbladder disease, a lot of hernias, and things like that. And that's why it's broad. But in our trauma practice, we pretty much can fix anything that is injured. And so that's why a good foundation in general surgery is important to be a trauma surgeon. The reason I'm practicing trauma critical care and acute care surgeon at an academic medical center is because I strongly believe in the three missions of an academic medical center. One is providing the highest level of patient care. Secondly, I believe that we can only move the needle with research. And lastly, I enjoy medical education. I enjoy the interaction with residents. I also enjoy being in an environment in which the cutting edge of research and knowledge is being displayed on a day-to-day basis. I'm also currently the Director of Global Surgery in the Institute of Global Health and Infectious Diseases. The reason for that is, of course, that when I came here to Chapel Hill 13 years ago, I started the Malawi Surgical initiative, which is an initiative to help provide clinical care, education, and research in Malawi. This has led to UNC's Department of Surgery being at the forefront of global surgery in the United States. So we had a very sort of scientific and precise approach to what we wanted to achieve in the field of global surgery from the outset. So when we went down to Malawi, we immediately started to develop a surgical training program for Malawian doctors to become surgeons. We also started a research endeavor whereby we started databases in trauma, in general surgery, in burns, in pediatric surgery, so that we can use that as a platform to build our research capacity. And lastly, we focused on education of both physicians and non-physicians to deliver surgical care. So by this sort of tripartite mission, we quickly transformed surgical care in Malawi. When I first went down there were only 14 Malawian surgeons. And in the space of 7 years, we had trained an additional 7. So one institution, one country, we almost increased the number of surgeons by 40%. And that is transformative. What I would want a patient to walk away from after watching this video is a couple of things. One, that UNC strives to provide the highest level of patient care. Secondly, the Department of Surgery is committed to the highest standards, and we will walk our patients through their healthcare needs from presentation to outcomes. And for me personally, to understand that when they come and see me, that I'm committed to shared decision making, and that I will explain in full what the patient's condition is, what the surgical treatment is, and what other non-surgical treatments there are, and we will come to a shared decision, because I strongly believe that the patients must participate in their own care.